Paradoxical worsening in tubercular meningitis. Introduction. Tubercular meningitis is the most severe form of the extrapulmonary TB. Despite adequate anti-tubercular therapy, paradoxical reaction may occur in the 30% of the CNS TB patients. Recognizing paradoxical worsening is critical to avoid the misdiagnosis as a treatment failure of a drug resistance. Case presentation. A 22-year-old male presented with the headache, vomiting since 3 weeks and altered sensorium since 2 days. On admission, he was drowsy, disoriented and not following commands. Vital was stable and signs of meningeal irritation were positive. Baseline MRI was normal. CSF analysis was advised but was refused. Based on the history and clinical presentation, a provisional diagnosis of tubercular meningitis was made and he was started on ATT along with the corticosteroids, leading to the improvement in the symptoms. Patient gained complete sensorium by the 5th day of the treatment and was discharged in the stable condition by day 12. Steroids were tapered and stopped at the end of 2nd month of the treatment. After 3rd month of the ATT, he developed a new onset of headache, irritability and the gait difficulty. Examination showed left-sided clonus with extensor plantar response. Repeat MRI revealed tubercular exudate with tuberculomas, suggestive of iris or paradoxical worsening. Corticosteroids were reintroduced in the ongoing treatment regime along with the supportive management, including hydration, optimum nutrition and physiotherapy for the gait difficulty. Over the course of the treatment, the patient showed the gradual clinical improvement with the reduction in the headache and the improvement in the ambulation. He was discharged in the stable condition with advice with strict follow-up and the continuation of ATT. Before starting ATT, 2 months before, MRI was normal. At clinical sign and symptom, we had started with ATT and made a diagnosis of TB meningitis. And after starting of 3 months of ATT, patient came with complaints of headache and gait difficulty, and we repeat the MRI, which is suggestive of multiple tuberculomas, ring enhancing lesions. Discussion. Paradoxical reaction, appearance or worsening of the lesion in the TB during therapy despite microbiological control. Mechanism, exaggerated immune response to mycobacterium antigen. Differential can be drug resistance, non-compliance or the secondary infection. Management, continue ATT, steroid help reduce inflammation, rarely surgical intervention if hydrocephalus or the mass effect develop. Conclusion is that paradoxical reaction is not a treatment failure. Awareness prevent unnecessary change in the regime, and imaging comparison should be done in vital for diagnosis. Thank you.